Pulse oximetry. First, the respiratory therapist will review the physician's orders and obtain the necessary equipment. Next, the respiratory therapist will wash her hands using warm water and mild soap or an alcohol-based hand rub.
I'm getting my physician's orders. Hi, I'm Ryan. I'm your respiratory therapist. Can I get your full name and date of birth? Alright, and can I look at your wristband, please?
At this time, the respiratory therapist is identifying her patient using her name and date of birth and 2 other patient identifiers, making sure to provide privacy for the patient. The respiratory therapist has explained the procedure and has obtained consent. The equipment is being assembled and turned on and tested prior to patient use.
Now, can I see your finger, please?
The respiratory therapist now inspects the patient's fingers to make sure that her nail beds are clear and her hands are not visibly soiled. The pulse ox probe is placed on the finger.
Alright. Your heart rate is 83 and your oxygenation level is 98.
Once the pulse ox probe is placed on the patient's finger, you wait until you get a nice waveform and see a visible reading. Once the reading takes place, that is the heart rate and the oxygen saturation of the patient. The respiratory therapist reported what was seen and told the patient what she saw. Now, she threw away her equipment, she threw away her gloves, and she performs hand hygiene again with alcohol-based hand rub, or she can wash her hands with warm water and mild soap again. Once the respiratory therapist has completed hand hygiene and the task of pulse oximetry, the last step is proper documentation. The task must be properly documented to ensure that all the results show up in the patient's medical record.